We are live now.
Namaskar. I'm Dr. Mukul Kumar Sharma, HOD, Bapuji College, Sarukhetri, Assam. On behalf of Enazuri, we are going to start our session on gender and sexuality. Now, we have among us Vice President of Sati. It's a Chennai-based organization through which Dr. L. Ramakrishnan has been working for the LGBTQ plus community, especially for enhancing their health. Namaskar. Moi আজি আমাৰ যৌনতা আৰু লিংগ শীৰ্ষক আলোচনা আৰম্ভ কৰিব লৈছো এনাজৰীৰ হৈ আমাৰ হৈতে আছে চেন্নাইত থকা সাথী নামৰ অনুষ্ঠানটোৰ উপসভাপতি ডক্টৰ এল ৰামকৃষ্ণন যোনে আজি আমাৰ লগত আলোচনা কৰিব আজিৰ বিষয়টো হ'ল আমাৰ LGBTQ plus community থুলতে যাক সমকামী সম্প্ৰদায় বুলি কোৱা যায় এই সমকামী সম্প্ৰদায়টোৰ যিটো স্বাস্থ্যৰ সমস্যাবিলাক তেওঁলোকক কেনেকৈ স্বাস্থ্য সেৱাৰ লগত সম্পূৰ্ণভাৱে জড়িত কৰিব পাৰি ভাৰতত তাৰ ওপৰত আমি আলোচনা কৰিম Our topic is for the discussion today is towards LGBTQ plus inclusive health care in India. Before going to start the actual session, let me introduce Enazuri a little bit. Enazuri is a non-profit organization based in Assam, founded by the social activist Mr. Milind Datta. Which is promoting education in different areas, including gender and sexuality. Enazuri whole eta Guwahatit thoka organization, jitu samajik kormi Milind Datta dangoriai সৃষ্টি কৰিছিলে আৰু যিটোৰ মাধ্যমেৰে আমি এনাজৰী মানুহখিনিয়ে বিভিন্ন ধৰণৰ শিক্ষাবিলাকৰ প্ৰকাৰত জড়িত হৈ আছো যাৰ ভিতৰত লিংগ আৰু যৌনতাও এটা পৰে So I welcome you Dr. L. Ramakrishnan for today's session. Dr. L. Ramakrishnan মই আপোনাক আজিৰ সেশনৰ বাবে আদৰণি জনাইছো Thank you for joining us Dr. L. Ramakrishnan.
Thank you very much Dr. Mukul Sharma for having me and it's a pleasure to be here with Anajuri.
Yes. Dr. Ramakrishnan, we first know about from you about the genesis of your organization Sati and how you have been working through it for upliftment of the health of especially of LGBTQ plus community. আমি আপনার পৰা জানিব খুজো আপনি সাথীৰ মাধ্যমেৰে কেনেকে LGBTQ plus community থ্ৰুতে যা সমকামী কমিউনিটি বুলি ক'ব পাৰি সম্প্ৰদায় বুলি ক'ব পাৰি তেওঁলোকৰ স্বাস্থ্যৰ উন্নতিৰ বাবে কেনেকে আপুনি সাথীৰ মাধ্যমেৰে কাম কৰি আছে কাৰণ আমি জানো সাথীত আপুনি বহু বছৰ ধৰি কাম কৰি আছে because we know that through Sati you have been working for years for especially for the upliftment of this community in terms of their health.
Yeah, thank you very much. So I joined Sati in the year 2004. 4 years before that, Sati was actually formed as an informal volunteer group of people in India, as well as people from India who are living and working abroad in medical and health and research professions, who wanted to find a group of people all interested in ending the HIV epidemic in India. So it was basically started as a volunteer group in the year 2000 and formally registered as an NGO in the year 2002.
Okay. মই জানিব পাৰি ভাল পাইছো যে সাথী আসলতে 2000 চনৰ পৰাই চেন্নাইত স্থাপিত হৈছিল আৰু 2002 এটো এটা অৰ্গানাইজেচন হিচাপে ৰেজিষ্টাৰ হ'ল আৰু তাৰ মাধ্যমেৰে বিভিন্ন মানুহবিলাকে দক্ষিণৰ যিবিলাকে আমেৰিকা বা বেলেগ বিদেশত কাম কৰি আছিলে তেওঁলোকে ছাতিৰ মাধ্যমেৰে বিশেষকৈ HIV কেনেকৈ ৰোধ কৰিব পাৰি তাৰ বাবে কাম কৰি আহিছে আৰু আপুনি 2004 পৰা 2004 চনৰ পৰা আজিলে ছাতিৰ মাধ্যমেৰে বিশেষকৈ HIV প্ৰিভেনশ্যনৰ কাৰণে HIV নোহোৱা কৰাৰ বাবে বা প্ৰতিবন্ধক অনাৰ বাবে বিশেষকৈ LGBTQ কমিউনিটিৰ প্লাছ কমিউনিটিৰ বাবে কাম কৰি আহিছে। Thank you. Yes.
I had
Next,
a part 2 to your answer. Is it possible to share that?
Yes,
I
please.
stopped so that you can translate. Yeah. So in that year, by year 2000, the number of people with HIV in India had grown quite significantly. But at that point of time, treatment was just coming up. And at the point, treatment was not available through the government public health program. It was only available to people who could afford private medicine. So part of our early advocacy efforts were to make HIV treatment a reality in the public health system in India. That was one of the main agenda items with which we started. The other agenda item with which we started was, as you know, at that point of time, Section 377 of the Indian Penal Code was still in force until very recently. And we had people joining Sati who were also from the LGBT community, like Pawan Dhal from Kolkata, who were already very active in the fight for decriminalization. So we started with getting HIV treatment in India as one focus, and the other focus being human rights, including decriminalization of LGBTQ relationships.
Okay. মই জানিব পাৰি ভাল পাইছো যে আপোনালোকে ছাতিৰ মাধ্যমেৰে HIV কাৰণে কিয় কাম কৰিব খুজিছিল 2002 সময়ত HIVৰ যিটো সংখ্যা অত্যন্ত বেছি আছিল আৰু সেই অনুপাতে HIVৰ লগত যিটো জড়িত স্বাস্থ্য সেৱা অত্যন্ত খৰচী আছিল সেইকাৰণে ছাতিৰ মাধ্যমেৰে আপোনালোকে HIV তাৰ চিকিৎসাটো যাতে গোটেই মানুহখিনিয়ে পায় বিশেষকৈ এইটো সমকামী সংস্থাটোৱে পায় বা সমকামী সম্প্ৰদায়টোৱে তাৰ পায় সেইটো কাৰণে আপোনালোকে যুঁজিব ধৰিলে কাম কৰিব ধৰিলে লগে লগে আপোনালোকে যিটো 377 ধাৰা যাৰ মাধ্যমেৰে ভাৰতত যিটো লাগু হৈ আছিলে 2018 চনলে যিটো মাধ্যমেৰে সমকামী যিটো যৌনতা তাক যিটো বেআইনী কৰা হৈছিলে সেইটো উঠোৱাৰ বাবেও আপোনালোকে কাম কৰি আছিলে আৰু কিছুমান বিভিন্ন ধৰণৰ নায়কৰ লগত টাই আপ হৈ যেনে পৱন কুমাৰ ঢাল যিটো পশ্চিম বংগৰ তেওঁলোকতো আপোনালোকে টাই আপ হৈ ইটোৰ বাবে কাম কৰিছিলে আৰু বিভিন্ন নায়কবিলাকৰ লগত আপোনালোকে 377 ধাৰাটো যাতে হেৰি কৰা যায় নোহোৱা হৈ যায় ভাৰতৰ পৰা তাৰ কাৰণে কাম কৰিছিলে আৰু 2018 চনত এইটো ইতিমধ্যে নোহোৱা হৈ গ'ল আৰু এতিয়া সমকামী যৌনতা এটা আইনগত দিশলৈ আহি গ'ল ভাৰতত আৰু সেইটোৱে হয়তো এইটো HIVৰ ক্ষেত্ৰত কাম কৰাৰ বাবে আপোনালোকক সহায় কৰিলে Thank you, Ramaki. One question raises to me, why it is so integral for repealing 377? Why it was so integral for repealing Section 377 in terms of reducing the number of HIV cases in India?
Thank you. Very good question. So very early on, it was established that men who have sex with men, okay, regardless of going into identity, as well as transgender women, were among the groups in which HIV risk of transmission and risk of acquisition was very high. And the prevention program required people to be able to identify these groups at risk in order to implement behavior change communication, condoms, referrals for counseling, etc. But because of the criminalized status of homosexuality and secondarily transgender communities, it became very difficult to reach out to these communities for HIV prevention programs. So that was the public health angle for decriminalization, that criminalization made it difficult to implement the program. But the other issue is that unless you have people who enjoy all of their basic rights, you can't get them to worked on health-seeking behavior, because people need to have self-esteem, people need to have self-confidence, people need to take care of themselves. And having the rights and dignity of a non-criminal person is one of the many factors that can contribute to people living with dignity and also taking care of themselves, which includes practicing safer behaviors, which can prevent or reduce the risk of HIV. Yes.
Yes. Thank you, Ramuki. মই সুধিছিলো যে কেনেকে 377 ধাৰা যেটো আইনৰ হেতুৱে কেনেকে বাৰু আমাক বাধা দি আছিলে HIV প্ৰিভেনচনৰ ক্ষেত্ৰত। আপুনি উত্তৰ দিছে যে 377 ধাৰাই যেহেতু সমকামী যৌনতা পুৰুষ আৰু পুৰুষৰ মাজৰ সমকামী যৌনতাক বেআইনী কৰিছিলে, সেই কাৰণে মানুহখিনি যিখিনি সমকামী ব্যক্তি সেইসকলৰ কাষলৈ যাবলৈ অত্যন্ত দিগদাৰ আছিলে, কাৰণ তেওঁলোক সম্পূৰ্ণভাৱে লুকাই থাকিব বাধ্য হৈ গৈছিল, যিহেতু যৌন কাৰ্যটো যিটো তেওঁলোকে কৰে বা যিটো ব্যৱহাৰত তেওঁলোকে অভ্যস্ত সেইটো এটা বেআইনী কাম। আৰু সেই কাৰণে যেতিয়া 2018 চনৰ ছেপ্টেম্বৰৰ পৰা 377 ধাৰাটো উঠাই দিয়া হ'ল আৰু সমকামী যৌনতা যিহেতু আইনগত হ'ল, তেতিয়াৰ পৰা এইবিলাক কথা আলোচনা কৰিবলৈও সহজ হ'ল, যেনে কণ্ডম ব্যৱহাৰ কৰাৰ যিটোৰ মাধ্যমেৰে HIV বহুত কমি যাব পাৰে, তেনেকুৱা কথাবিলাক পাতিবলৈও সহজ হ'ল। আৰু গোটেই সমাজখনক বুজাব পৰা গ'ল যে কিছু পৰিমাণে হ'লেও যে সমকামী যৌনতাটো এটা প্ৰাকৃতিক ধৰণৰেই কথা, আৰু যেতিয়ালে গোটেই মানুহখিনিয়ে এইটো এটা প্ৰাকৃতিক বুলি নলয়, তেতিয়ালে এই যৌনতাটো এটা বেআইনী হিচাপে যদি হৈ থাকে, তেতিয়া কেতিয়াও এই HIVৰ সমস্যাটো সম্পূৰ্ণভাৱে ভাৰতত নোহোৱা কৰিব।
You've gone mute. You have to unmute yourself, Dr. Mukul.
Sorry for the interruption. Yes, Ramki, are you hearing me? Yes. Ramki, our next question is, what is the current situation of the LGBTQ plus people of India in terms of getting proper healthcare facilities in India? ভাৰতত এতিয়ালে LGBTQ plus community বা সমকামী যিটো গোষ্ঠী, সেই গোষ্ঠীটোৰ কেনেকুৱা এটা তেওঁলোকৰ পৰিস্থিতিত আছে, এইটো বিষয়ত যে যিটো তেওঁলোকৰ স্বাস্থ্যৰ সেৱা দৰকাৰ, সেই দৰকাৰখিনি পোৱাৰ ক্ষেত্ৰত কেনেকুৱা এটা পৰিস্থিতিত তেওঁলোকে আছে, তেওঁলোকে পাইছেনে বাৰু? Yes, Ramki.
Yeah. Thank you. So I'm going to include I and speak about LGBTIQ persons, because there are certain health issues specific to intersex people.
Yes.
Overall, the problem faced by LGBTIQ people in healthcare is, for some people, that of the invisibility of the community. For other people, it's that of visibility. Okay, so let's assume that there's an individual, specifically maybe gay or lesbian or bisexual, whose external appearance does not give away their sexual identity or sexual orientation. And such a person is just assumed to be heterosexual. If such a person goes to a healthcare facility, the healthcare providers just assume that the person is heterosexual. If it's a woman, they will ask her a question, are you married? And this is simply their way of finding out if she's sexually active. So there are two assumptions there, that the only kind of sex that happens is with a man in the context of marriage. So because of this this invisibility that some sections of the LGBTIQ community have, they will be assumed to be heterosexual, which can lead to all kinds of issues during diagnosis, where people will, the healthcare providers will just assume their behaviors and their orientation to be heterosexual, which can have implications for treatment. It can have implications for whether they are being prescribed birth control, etc. The other issue is those who are visibly different, particularly visibly gender non-conforming. So they could be transgender, non-binary people. It could be people from the LGBT from the LGB community who look different, like a lesbian who presents in a way that is, butch or masculine, or a gay person a gay man who presents in a way that is feminine. So in such cases, where they are visibly different, there can be ridicule, there can be harassment, which starts all the way from the reception and the ward boy and other patients in the outpatient clinic. It can be the nurses, etc., where individuals are pointed out, their differences pointed out. A lot of transgender people have told me that even if they go for a completely unrelated health issue, the doctors, seeing that here's a transgender person, often make that person disrobe and display their genitals to other doctors and postgraduate students to say, this is what a transgender person's genitals look like. Of course, the assumption here is that the person is post-operative, but still this kind of humiliation happens very often in the name of science and medicine. So if you are visible, you face a different kind of challenge. If you're invisible, you face a different kind of challenge. But even if you don't go to the doctor, the problem is that the doctor has studied MBBS and MD using Indian textbooks that have a very distorted and outdated set of information on homosexuality. There is a very standard first-year book on forensic medicine that basically talks about lesbians being nymphomaniacs and prone to commit homicide and suicide. Almost all textbooks, even though the section 377 is decriminalized, speak about same-sex behavior as a criminal offense, or as a psychosexual disorder, even though World Health Organizations and other organizations have clearly said that this is not a disorder. So pathologization, inaccurate information is really found in many of the medical textbooks and disciplines, whether it's psychiatry or forensic medicine or obstetrics and gynecology, etc., etc. So even the doctors graduating from an Indian medical college come with very little information that is accurate. So they are already there is already a lot of bias in their minds. And then if they actually get the chance to encounter a client who is openly LGBTIQ, that translates into substandard healthcare behavior, healthcare provision. Yeah.
Thank you, Ramakrishnan.
These are some of the issues. Go ahead and I'll add points later. Please go ahead. Yeah.
Okay, Ramakrishnan. মই ভাল পাইছো শুনি যে আপুনি কৈছে যে LGBTQ plus community তাৰ লগত LGBTQI community to ক'ব পাৰি I খিনিও আছে intersex community তেওঁলোকৰ বিভিন্ন সমস্যা আছে মেডিকেলৰ হেল্থ কেয়াৰৰ হেৰিখিনি পোৱাৰ বাবে স্বাস্থ্যৰ সেৱাখিনি পোৱাৰ আগতে কাৰণ LGBTQ+ কমিউনিটিটোৰ বহুতখিনি আছে যিখিনি দেখিলে কোনো ধৰণৰ একো ক'ব নোৱাৰি আৰু মানুহে তেওঁলোকক হেটেৰোসেক্সুৱেল বুলি ভাবে আৰু ডক্টৰ বিলাকেও ভাবে যেহেতু তেওঁলোকৰ টেক্সটবুক বিলাকত homosexual ব্যক্তিবিলাকৰ LGBTQ+ ব্যক্তিবিলাকৰ বিষয়ে কোনো এটা ভালকে তেওঁলোকক শিক্ষা দিয়া হোৱা নাই সেইকাৰণে এগৰাকী যদি লেছবিয়ান যায় যিগৰাকী একেবাৰেই ফেমিনিন দেখাত বা ব্যৱহাৰত তেওঁক প্ৰথমেই প্ৰশ্ন সোধা যায় যে আপুনি বিবাহিত নেকি কোনোবা ল'ৰাৰ লগত আপোনাৰ বিবাহ হৈছে নেকি যদি তেওঁ বিয়া কৰাইছে নে নকৰাইছে সেইটোতকেও তেওঁ বিবাহ হৈছে নে নাই সেইটোহে গুৰুত্বপূৰ্ণ হৈ যায় লেছবিয়ান হলে বিয়া নহবওতো পাৰে আৰু সেইনেকে বহুতখিনি ধৰণৰ মানুহবিলাকৰ ওপৰত যিখিনি কোনো ব্যৱহাৰৰ পৰা গম নাপায় যে হেটেৰোসেক্সুৱেল যেন লাগে সেইখিনি গে বা লেছবিয়ানৰ অত্যন্ত ধৰণৰ এক ধৰণৰ মানসিক চাপ পৰে বা অলপমান তেওঁলোকে অপমানিত বোধ কৰে তাৰোপৰি ট্ৰান্সজেন্ডাৰ বিলাকৰ যিবিলাক ৰূপান্তৰকাৰী বা ৰূপান্তৰকামী ব্যক্তি আছে সেইবিলাকৰ তেওঁলোকৰ সমস্যাটো আৰু বেছি থাকে কাৰণ প্ৰথমেই যেতিয়া ডক্টৰৰ তাত যায় তেওঁলোকৰ বেলেগ যদিও এটা বেমাৰত যায় যিটো যৌনতাৰ লগত জড়িত নহয় তেতিয়াও তেওঁলোকক মানে একোটা গিনিপিকৰ দৰে ব্যৱহাৰ কৰিব খোজে জোৰ কৰি তেওঁলোকৰ জেনাইটেল বিলাক যৌনাংগ নিজে চাই বা ষ্টুডেন্ট বিলাকক দেখুৱাব খোজে কাৰণ তেওঁলোকে জানিব খোজে যে ট্ৰান্সজেন্ডাৰ বিলাকৰ যৌনাংগৰ হেৰিটো কেনেকুৱা তেনেকেও বহুতখিনি অপমানিত বোধ কৰে এইটো এই কাৰণেই হৈছে, আপুনি কৈছে যে যিহেতু ভাৰতীয় চিকিৎসা সেৱাত LGBTQI+ কমিউনিটিটোৰ বিষয়ে কোনো ভালকে একো লিখা হোৱা নাই। তেওঁলোকে এই কমিউনিটিটোৰ বিষয়ে কোনো ধৰণৰ ভাল অভিজ্ঞতা তেওঁলোকৰ নাথাকে, আৰু তেওঁলোকে সেইকাৰণে মানুহখিনিৰ সমস্যাটো বুজিব নোৱাৰে, আৰু বুজিব নোৱাৰাৰ বাবে তেওঁলোকে যিখিনি প্ৰশ্ন কৰে সেইখিনি প্ৰশ্নৰ দ্বাৰা মানুহখিনি অত্যন্তভাৱে অপমানিত অনুভৱ কৰে বেছিভাগ ক্ষেত্ৰত। তাৰোপৰি যিখিনি লেছবিয়ান আৰু গে আছে, যিখিনি দেখাত এজন লেছবিয়ান, তেওঁৰ পুৰুষসুলভ ব্যৱহাৰ আছে অত্যন্ত বেছি, আৰু বা এগৰাকী গে যাৰ খুব নাৰীসুলভ ব্যৱহাৰ আছে, তেনেকুৱাখিনিও আছে। তেনেকুৱাখিনি যেতিয়া হস্পিটেলত যায়, তেওঁলোকে অপমানিত কিছুমান মন্তব্য, যিটো আমাৰ ভাৰতত এতিয়াও চলি আছে, তেনেকুৱা মন্তব্যৰ মুখামুখি হয়। আৰু এইবিলাক পৰিস্থিতিতেই বৰ্তমান LGBTQI+ কমিউনিটিটো বৰ্তমানো আছে, যি আচলতে ক'ব গ'লে হেল্থ কেয়াৰ, যিটো স্বাস্থ্যৰ সেৱাৰ পৰা আচলতে বঞ্চিত হৈ আছে। Thank you, Ramki. Our next question is to you.
Yeah, I just wanted to speak.
Yes,
sorry,
please.
Could I continue that with just one more point? Yeah.
Yes,
I wanted to speak about intersex individuals. So intersex individuals are people born with bodies different from the male and female binary. And there's almost 1 in 100 persons is intersex. Now, some of these intersex individuals are born as infants with ambiguous genitals. The genitals are not clearly defined as male or female. Now, what happens in the medical system is that the doctors delivering the child very often see this as a huge crisis. And even if it is not medically necessary, they will perform surgery on the infants, genital surgery on the infants, to quote unquote correct it and make it conform to a typical male or a typical female. And so, for example, an infant may be born with an organ that does not look large enough to be a penis in their mind, or it looks too large to be a clitoris. And the rest of the genitals may be ambiguous. They might, even if it's not medically necessary, they will perform a surgery in many cases. And this is quite prevalent in India. There is only one high court decision in Tamil Nadu that bans it, and a recent statement in Delhi against it. But this is a particular health problem faced by intersex people who are born with, or the subset of intersex people who are born with genitals that are intermediate or ambiguous.
ধন্যবাদ ৰামাকি। LGBTQ+ কমিউনিটিৰ ভিতৰত এটা আই বুলিও আছে, LGBTQI এই বুলি কয় আচলতে। আইখিনি হ'ল ইণ্টাৰছেক্স। আপুনি ইণ্টাৰছেক্সৰ সমস্যাখিনিৰ কথা কৈছে, যিখিনি আমিও বৰবাতে ভালকে বুজি নাপাওঁ, কাৰণ ইণ্টাৰছেক্স কমিউনিটিৰ মানুহ খুব কম। ইণ্টাৰছেক্সবিলাক হ'ল তেওঁলোকে ঠিক মতা মাইকীৰ ঠিক এটা বাইনেৰী হেৰিত তেওঁলোকৰ দেহাটো নপৰে জন্মৰ সময়তে, আৰু তেওঁলোকৰ জেনাইটেলবিলাক ঠিক মতা মাইকীৰ যৌনাংগৰ যিটো আকৃতি তাৰ সম্পূৰ্ণভাৱে সেই হেৰিটোত খাপ নাখায়গে। সেইকাৰণে যিহেতু ভাৰতীয় চিকিৎসা ব্যৱস্থাত ইণ্টাৰছেক্স বা LGBTQ+ কমিউনিটিৰ বিষয়ে কোনো ভাল এটা পাঠ নাই, তেওঁলোকে নাজানে। তেওঁলোকে ভাবে যে এইটো এটা কিবা শাৰীৰিক হেৰি হৈছে, ডিফৰ্মিটিৰ কাৰণে হৈছে, আৰু সেইকাৰণে তেওঁলোকে সেই জেনাইটেলটো যিটো ধৰক মতা বা মাইকী যৌনাংগৰ লগত ভাল এটা মিল নাই, তেওঁলোকে জোৰ কৰি সেইটো পেচেণ্টক সুধি বা নুসুধি, বা পেচেণ্টক দৰকাৰ হওক বা নহওক, তেওঁলোকে জোৰ কৰি এইটো এটা ধৰক মতা মানুহৰ যৌনাংগলৈ ৰূপান্তৰিত কৰা চাৰ্জাৰী কৰি দিব পাৰে, অথবা মাইকী মানুহৰ যৌনাংগৰ এটা চাৰ্জাৰী কৰি তেওঁলোকে কৰাই দিব পাৰে, আৰু যিটো আচলতে ক'ব গ'লে এটা বেআইনী কাম আৰু এটা অত্যন্ত অমানৱীয় কাম। আৰু আপোনাৰ পৰা জানি ভাল লাগিছে ইতিমধ্যে চেন্নাইত আৰু দিল্লীত এই কামটো বেআইনী বুলি ইতিমধ্যে জাৰি কৰা হৈছে। ধন্যবাদ ৰামকি। Thank you, Ramki. Our next question is a little bit personal. What did motivate you to work for Saatchi? Because as I know that your PhD is not related to directly social work, and you served in America for a few years, then you came back and then started working for Saatchi. To a certain extent, a big academic sacrifice. What did motivate you? আপোনাক কিহে বাৰু সাথীৰ লগত কাম কৰিবলৈ আপোনাক কিহে বাৰু হেৰি কৰিলে, উৎসাহিত কৰিলে? Please give us the full meaning of Saatchi also, and please tell us what did motivate you to work for Saatchi.
Yeah, the full expansion of Sati is in that this thing above me, solidarity and action against the HIV infection in India. So yeah, you're right. I went to do a PhD and I also worked in an area of which is broadly called integrative biology, which looks at behavior, ecology, evolution, genetics, and so on. But one of the aspects that I got very interested in as part of my academic work was mathematical modeling in biology in multiple areas. So I worked in the area of mathematical modeling in the area of conservation biology, as well as in the area of infectious disease modeling. So whether you are studying populations of endangered species and figuring out the best way to manage them to prevent them from going extinct, or you're studying populations of pests or pathogens or disease causing organisms to study the best way to make them extinct, the framework of understanding this in mathematical terms is very similar. So I had an academic interest in infectious diseases, but also in terms of social work, I had always been volunteering for multiple causes. One cause that I began with volunteering with when I was in the States was mental health and support for survivors of domestic violence. These were primarily cis heterosexual women from India and other parts of South Asia who were living in the US and who are facing violence, most often from their husbands and in-laws. And many of them did not know the local language, did not know how to tap into the local resources. So there was a group called Saheli that worked specifically for women from South Asia. And as I volunteered for the group, there were a few other men also who were volunteering for that group. We got trained in counseling. And this was a useful skill because we were able to support clients, but I also got a deeper understanding into the nature of family violence, also the nature of heteropatriarchy and how it oppresses everyone, especially how the oppression faced by heterosexual women or women of all orientations and oppression faced by LGBTIQ people is similar, because both of these oppressions are rooted in a very binary, heterosexist, patriarchal worldview. So along with volunteering at Saheli, I also volunteered with ALGO, which is a group that worked with the LGBTIQ minority community in the city where I worked. By minority, it was primarily people of who were African American, Latin American, and Asian American. So where we got to learn that even within the LGBT community or LGBTIQ community, not everybody face the same level of problem. People belonging to a minority race or religion, and here in the Indian context, caste, also face multiple oppressions. So I did have this volunteer association with human rights and social work. And when the time came for me to return to India, which is always part of my plan, I was looking at jobs both in applied biology and sciences, as well as jobs that were in the area of human rights and health. So it just so happened that there was this kind of opening, and I was lucky to be selected for it.
Thank you, Ramaki.
I can tell you more after you finish translation.
Yes. Thank you, Ramaki. Apuni কৈছে যে আপুনি এগৰাকী আচলতে বায়োলজিৰ ছাত্ৰ আছিলে PhD লেভেলত, কিন্তু আপোনাৰ ইনফেক্টিছ ডিজিজৰ ওপৰত সংক্ৰমিত বেমাৰবিলাকৰ ওপৰত আপোনাৰ এটা বিশেষ ধৰণৰ ৰাপ আছিলে, আৰু সেইটোৱে আপোনাক হয়তো HIV বাবে কাম কৰিবলৈ অনুপ্ৰেৰণা যোগাইছিল। আৰু যিহেতু LGBTQ প্লাছ কমিউনিটিটোৰ অত্যন্ত সমস্যাৰ লগত আপুনি গম পাই আছিল আমেৰিকাত, যিহেতু আপুনি কাম আৰম্ভ কৰিছিল PhD পিছত, যে তেওঁলোকৰ যি শোষণ হয়, তেওঁলোকৰ ওপৰত যি অত্যাচাৰ হয়, তেনেকুৱা সমস্যাবিলাক আপুনি কিছু হ'লেও গম পাব ধৰিলে। আৰু যদিও আপোনাৰ PhD-টো সেইটোৰ ওপৰত চিধা নহয়, যেতিয়া আপুনি আমেৰিকাত কাম কৰিলে LGBTQ কমিউনিটিটোৰ বিষয়ে কিছু জানিলে, আপুনি ভাৰতলৈ ঘূৰি অহাৰ যিটো আপোনাৰ পৰিকল্পনা আছিলেই, অহাৰ পিছত আপুনি এনেকুৱা ঠাইত চাকৰিৰ কাৰণে দৰখাস্ত দিলে য'ত আপুনি মানৱ অধিকাৰ, হিউমেন ৰাইটছ, মানৱ অধিকাৰৰ কাম কৰিব পাৰে, অথবা য'ত LGBTQ প্লাছ কমিউনিটিখিনিক জড়িত কৰি কাম কৰিব পাৰে, তেনেকুৱা ধৰণৰ মানৱ অধিকাৰ বা ইনফেক্টিয়াছ ডিজিজৰ লগত জড়িত সমস্যাবিলাকৰ লগত জড়িত যদি সংস্থা আছে তেনেকুৱা ধৰণৰ আপুনি এপ্লাই কৰিব ধৰিলে আৰু আলটিমেটলি আপুনি সাথীত কাম কৰিব ধৰিলে য'ত আপুনি HIV প্ৰিভেনশ্যনৰ কাৰণে কাম কৰি আছে LGBTQ+ কমিউনিটিক অন্তৰ্ভুক্ত কৰি Thank you, Ramaki. Our next question is, what are the challenges of reaching out to the LGBTQ plus community? Because many of this community are still very much invisible in India in terms of giving them the better healthcare facilities in India.
Yeah, thank you. I think with the LGBTIQ community that again, there are segments of the community that is more visible than others. So trans feminine persons, for example, are quite visible, especially the traditional Hijra or Kinnar or Tirunangai community. The rest of the communities, especially that is more gender conforming or can pass easily, they tend to be more invisible. And what keeps people invisible or what keeps people in the closet is, of course, fear of the repercussions, fear of the negative consequences of coming out, right? So I think that is something that when I looked for a support system, the first kind of support system that I found was actually not when I was in India, but when I was abroad. But when I returned in the year 2004, I saw that many cities actually had small support groups. They may not be particularly visible, they may not be in the media, but there were support groups and there were social gatherings happening for at least for gay and bisexual men. For lesbian and bisexual women, there were probably 5 or 6 groups in the country at that point of time. But there were a lot of groups that were working with the trans feminine community. Trans masculine people were and continue to be relatively invisible, though this has changed in the last few years. And I think of the different communities that face oppression and face challenges from society, I think trans masculine people and lesbian and bisexual women in particular face a lot of challenges having to deal with the the double discrimination of being female assigned at birth and being non-heterosexual or non-cis, being trans. So being from the community, it is probably easier to build a rapport with other community members. And whenever we have done sensitization for healthcare providers, we have done programs in Manipur, we have done programs in Odisha, we've done Kerala, Gujarat, etc., etc. We always work with local community organizations where there is already a level of trust built, and there are some individuals who are confident and comfortable to come forward and declare their identity in front of a group of medical professionals and speak about the challenges they face. And it's not only about healthcare, we also do work around inclusive education, inclusive legal services, social services, etc. So in whatever domain it is, right now, I think we are in a good position that there are community members across the country, who are, at least some of them are reaching out to their peers and providing support, and some of them are also confident and able to be out.
Thank you, Ramaki. মই আপোনাৰ পৰা জানি ভাল লাগিছে যে LGBTQ+ কমিউনিটিটোৰ খুব চেলেঞ্জিং হয় তেওঁলোকৰ হেল্থ কেয়াৰৰ সুবিধাবিলাক দিয়াৰ কাৰণে, কাৰণ বেছিভাগ মানুহে ওলাই আহিব ভয় কৰে গোটেই সামাজিক ব্যৱস্থাটোৰ কাৰণে। যেতিয়া আপুনি 2004 ঘূৰি আহিছিল আমেৰিকাৰ পৰা, তেতিয়া আপুনি কোনো ফৰ্মেল কমিউনিটি আপুনি পোৱা নাছিলে য'ত LGBTQ কাম আনুষ্ঠানিকভাৱে কোনোবাই কৰি আছে, কিন্তু ইনফৰ্মেলি ভিতৰে কিছুমান গ্ৰুপ আপুনি পাইছিলে, আৰু সেইখিনি গ্ৰুপৰ লগত আপুনি কাম কৰিব ধৰিলে তেওঁলোকৰ সমস্যাবিলাকৰ কাৰণে। বিশেষকৈ আপুনি গম পাইছিলে যিখিনি মানুহ লেছবিয়ান বা গে তেওঁলোকক দেখাত হেটেৰ'ছেক্সুৱেল যেন লাগে, সেইখিনি মানুহে বিভিন্ন ধৰণৰ অপাৰেশ্যনত তেওঁলোকে আছিলে, বিশেষকৈ তেওঁলোকৰ বিয়া হৈ যোৱাৰ পিছত যিটো সমস্যা হয় তেনেকুৱাবিলাক সমস্যা হয়তো আপুনি পাইছিলে। আৰু যিয়েই নহওক, এইবিলাকৰ মাজেৰে আপুনি গম পাইছিলে যে যেতিয়ালৈ মানুহবিলাক ওলাই নাহে, কামিং আউট বুলি যিটো কয়, তেতিয়ালৈ মানুহখিনিৰ সমস্যাটো ৰৈয়ে যাব। আৰু সেইকাৰণে আপুনি বিভিন্ন গ্ৰুপবিলাকৰ লগত মানুহখিনিক নিজে এজন কমিউনিটি মেম্বাৰ হিচাপে মানুহখিনিক যিহেতু উৎসাহিত যোগোৱাৰ কাৰণে আপুনি নিজেই অলপ ভাল এটা স্থানত থকা বুলি ভাবি বিভিন্ন ধৰণৰ কেৰালা, বিভিন্ন ধৰণৰ ৰাজ্যত যেনে কেৰালা, মণিপুৰ উৰিষ্যা আদিত আপুনি কেম্পেইন কৰাব ধৰিলে যাতে মানুহখিনি এটা সাহস পায় আৰু তেনেকে আপুনি আজি হেৰিলে আহিলে আৰু এতিয়াও যথেষ্ট প্ৰত্যাহ্বান আছে মানুহখিনি আপুনি ভাবে Ramki, which is the sub community of LGBTQI plus community which need more special attention in terms of giving them the better health facilities. আপুনি কোনটো উপসম্প্ৰদায় LGBTQ প্লাছ সমকামী ব্যক্তিখিনি কোনটো আটাইতকৈ বেছি ধৰণৰ এটা বিশেষ সুবিধা দিয়া দৰকাৰ বুলি আপুনি ভাবে যিটো স্বাস্থ্য সেৱাৰ ক্ষেত্ৰত
I think in terms of medical issues, there are certain issues that are common to everybody. For certain communities, for example, the transgender communities, of whom some seek medical transition, which could be, hormone therapy or gender affirmative surgery, etc. They especially need a set of specialists like psychiatrists, endocrinologists, surgeons, plastic surgeons, etc. So I think it becomes most challenging for them to seek out that specialized care because of the shortage of such specialists who are trained and well informed and are also inclusive of the community. So for example, there are people in Northeast India who want a psychiatrist to give them a letter of gender dysphoria or gender incongruence. And there are very few people there, so they end up trying to reach out to people, to doctors in other parts of the country. So in that sense, I think because of the specialized needs, the trans masculine and trans feminine communities find it most challenging to get the specialized healthcare needed for transition. But a couple of things is that not all trans people require transition or seek transition. That's one issue. The other thing is that there are a whole lot of health conditions that occur to anybody, regardless of sexual orientation or sexual behavior or gender identity. And there the challenge is, if the group is invisible and if they find it difficult to speak about their identity and that identity or their behavior is relevant to the health condition, then it becomes challenging for gay, lesbian, and bisexual people as well. And I think overall people who are seen as women face more challenges because of the social expectations which are also reflected in healthcare around gender roles and gender appropriate behavior, etc., etc. I know that a lot of people think that bisexual persons face a lot more challenges in accessing healthcare, but I just wanted to dispel the notion bisexuality isn't necessarily about sexual behavior. A person could be asexual and bisexual, could be celibate and bisexual. A person could be celibate and bisexual. A person could be in a relationship with one person and bisexual, etc. So bisexuality by itself does not imply that the person necessarily has health conditions that require attention, that are difficult to access. But then again, you're right, when it comes to the stigma in the healthcare profession, possibly transgender people as well as bisexual people face, awkward questions, offensive questions, and so on. But then so do the gay and lesbian people. So it's really hard to figure out who is most challenged.
Exactly. মই শুনি ভাল পাইছো আপুনি উত্তৰটো যে আপুনি ক'ব খুজিছে যে LGBTQ প্লাছ কমিউনিটি সমকামী কমিউনিটিটোৰ ভিতৰত আটাইতকৈ ট্ৰান্সজেণ্ডাৰ কমিউনিটিখিনি ট্ৰান্সজেণ্ডাৰ বা ৰূপান্তৰকামী বাকাৰী কমিউনিটিটো সম্প্ৰদায়টোৰ আচলতে আটাইতকৈ বেছি চিকিৎসা সেৱাৰ দৰকাৰ কাৰণ তেওঁলোকে বিভিন্ন বেছিখিনি মানুহে তেওঁলোকে চাৰ্জাৰী কৰি তেওঁলোকৰ জেণ্ডাৰ যিটো তেওঁলোকৰ বিপৰীতকামী জেণ্ডাৰলৈ গুচি যাব খোজে আৰু এই চাৰ্জাৰীটো অত্যন্ত ব্যয়বহুল হোৱাৰ বাহিৰেও সেই চাৰ্জাৰীটো কৰিব পৰা অভিজ্ঞতা থকা ডক্টৰ সেইকেইটা চাৰ্জাৰী কৰা ডক্টৰ বিভিন্ন জাগাত বহুত কম আছে বিশেষকৈ ভাৰতত আৰু সেইকাৰণে তেওঁলোকে এই ক্ষেত্ৰত অত্যন্ত এটা সমস্যা পাই আছে তাৰোপৰি আপুনি ক'ব খুজিছে যে বাইসেক্সুৱেল বিলাক যিটো উভয়কামী ব্যক্তি তেওঁলোকৰো সমস্যা আছে কাৰণ তেওঁলোকৰ যেতিয়া ডক্টৰৰ তাত যায় তেওঁলোকৰ সমস্যাখিনি ডক্টৰে বুজিয়ে নাপায় কাৰণ তেওঁলোকৰ ক্ষেত্ৰত সেক্সুৱেল বুলিয়েই ভাবে আৰু সেইটোৰ কাৰণেও তেওঁলোকে বিভিন্ন ধৰণৰ মেডিকেল সুবিধাবিলাকৰ পৰা তেওঁলোকে বঞ্চিত হৈ ৰ'বলগীয়া হয়, নিজে আগুৱাই যাব ভয় কৰে, তেওঁলোকৰ সমস্যা আছে। গোটেই LGBT কিউ প্লাছ কমিউনিটিটোৰে আচলতে সমস্যা, গে লেছবিয়ানখিনিৰো সমস্যা আছে। আৰু কিন্তু আটাইতকৈ আপুনি ভাবে যে ট্ৰান্সজেণ্ডাৰ কমিউনিটিটো, ৰূপান্তৰকাৰী সম্প্ৰদায়টো আটাইতকৈ বেছি স্বাস্থ্যৰ ক্ষেত্ৰত সুবিধা পোৱা দৰকাৰ বুলি আপুনি ভাবে? Thank you, Ramaki. Our next question is about mental health issues you have talked about, you have just mentioned about. Did you work for mental health issues of the community? Because it's a big issue. Because you don't know the community members, you really do not know properly to maintain their mental health, because lack of awareness, due to the lack of awareness in India regarding mental care of the mental health. So did you work for this issue, boosting the mental health, enhancing the mental health of the LGBTQ plus community through Sati?
Yes. Okay, yes, through Sati, a lot of our engagement has been particularly with mental health professionals, including psychiatrists, clinical psychologists, medical and psychiatric social workers, peer counselors, etc. And when we talk about mental health, a huge impediment to the mental health of the LGBTIQ communities is basically mainstream society, the heterosexism, the homophobia, biphobia, and transphobia, which causes a lot of stress combined with things like forced marriage and so on. All of these are major stressors affecting the mental health of the community, leading to anxiety and possibly depression and other issues. So I think also in the minds of a lot of parents of LGBTIQ persons, when their children come out to them, their first thought is that it's a mental issue or a mental disorder. So a lot of work needs to be done in educating society in general and healthcare professionals in particular, because as we said, a lot of healthcare providers also have not received accurate information through their textbooks. So we have to do a lot of work of educating healthcare professionals, including mental health professionals, of what science says, what the World Health Organization says, what the Indian Psychiatric Society says, that this is not a mental health issue. And in fact, recently WHO also had a statement around transgender, where the term gender identity disorder was removed from the International Classification of Diseases and replaced with gender incongruence. So we engage with mental health professionals. We also engage with members of the community who call our offices. Sati has offices and it has helplines in Kolkata and Delhi, and people call any of our 12 offices with questions around gender and sexuality. And we want to make sure that we have a lot of social workers on our staff. So we make sure that they at least get the immediate support they need, but then also refer them to professionals if they need that kind of help. So we have facilitated a lot of continuing medical education, or CME, for psychiatrists. We worked with psychiatrists from East and Northeast region in an annual conference that took place in Manipur in Imphal a few years ago. We have engaged with Indian Psychiatric Society in Odisha and Kerala, in other states. One of our successes is last year, the State Mental Health Authority released the most recent state mental health policy, which has 1.5 pages on LGBTQ issues, basically reaffirming that it is not a disorder and exhorting doctors not to practice conversion therapy, which is the unscientific and illegal and unethical practice of trying to change someone's gender identity or sexuality. And we were able to get it into the policy. Now, whether we get it into practice or not is a matter of time, a matter of further engagement with the government authorities. But yes, mental health professionals, we do a lot of work with. When communities directly contact us for help, some of us have that training to be able to provide the support, but we would refer people to support groups in their town as well as professionals in their town if they'd like it.
Yes. Ramki, I request you to send us the link or the phone numbers of Sati immediately after this session so that we can upload it to the video so that people can reach out to this organization. মই সোধা প্ৰশ্নটো আছিল যে মানসিক স্বাস্থ্য যিটো LGBTQ+ কমিউনিটিটো সমকামী সম্প্ৰদায়টোৰ এটা অত্যন্ত ডাঙৰ সমস্যা ভাৰতত, কাৰণ বেছিখিনি কমিউনিটি মেম্বাৰেই নাজানে যে মানসিক সমস্যাবিলাক আচলতে কি বা মানসিক স্বাস্থ্যৰ কেনেকৈ যত্ন ল'ব লাগে ভাৰতত, কাৰণ ভাৰতত এই শিক্ষাটো একেবাৰেই নাই বুলি ক'ব পাৰি। আপোনালোকে ছাত্ৰীৰ মাধ্যমেৰে বিভিন্ন মনস্তাত্ত্বিকবিলাকৰ লগত আপোনালোকে জড়িত হৈ কাম কৰি আছে, আৰু আপোনালোকৰ ছাত্ৰীৰ অফিচত কমিউনিটি মেম্বাৰবিলাকে আহিও বিভিন্ন ধৰণৰ প্ৰশ্ন তেওঁলোকে সুধিব পাৰে, মানসিক স্বাস্থ্যৰ বিষয়ে তেওঁলোকে সজাগ হ'ব পাৰে, তাৰ কাৰণে আপোনালোকে মানুহ ৰাখিছে। আৰু আটাইতকৈ আপোনালোকৰ সফলতা বুলি ক'ব লাগিলে আপোনালোকে বিভিন্ন ৰাজ্যতো ইণ্ডিয়ান চাইকেট্ৰিক এছ'চিয়েশ্যনৰ লগত জড়িত হৈ কাম কৰি ধৰিছে, যাতে মানসিক স্বাস্থ্যৰ বিষয়ে আনকি চিকিৎসা শাস্ত্ৰটো এইটো বিষয়ে যাতে ভালকে আহে, কাৰণ এতিয়ালৈ সেইটো খুব ভালকে অহাই নাই। আপোনালোকৰ এটা ডাঙৰ সফলতা চেন্নাইত যে ষ্টেট মেণ্টেল হেল্থ পলিচিত ৰিচেণ্টলি 1.5 পেজ এটা আৰু আধা পেজ ডেৰটা পেজ মানে LGBTQ+ পিপল মানুহখিনিৰ সম্প্ৰদায়ৰ মানসিক স্বাস্থ্যৰ ওপৰত তেওঁলোকে লিখিছে, আৰু তেওঁলোকে এতিয়া যিটো কনভাৰ্চন থেৰাপি বুলি আছে, যিটো হোমোচেক্সুৱেল ব্যক্তিক হেটাৰ'চেক্সুৱেল কৰা যিটো এটা প্ৰেক্টিচ চলি আছে সাইক'ট্ৰিষ্ট বা সাইক'লজিৰ মাজত, সেইটো ইলিগেল বুলি আৰু এইটো আনএথিকেল বুলি হেৰি কৰিছে। তাৰোপৰি সাইক'ট্ৰিষ্ট বিলাকক যাতে এইটো কামৰ পৰা বাধা দিব পাৰি, তাৰ কাৰণে তেওঁলোকে স্পেচিয়েলি তাতে বিশেষকৈ মেনশ্যন কৰিছে। এতিয়া ইমপ্লিমেণ্ট কিমানখিনি হ'ব নাজানে, কিন্তু আপোনালোকৰ মাধ্যমেৰে এইটো চেন্নাইত এইটো তামিলনাডুত আৰম্ভ হৈছে, আৰু এইটো আপোনালোকৰ এটা ডাঙৰ সফলতা। Ramki, our next question is, what are the areas still you think that LGBTQ+ people need special attention in terms of enhancing their health?
I think mental health is an all-time important issue, and I think attention needs to be paid right from when they are students to prevent to prevent traumas resulting from violence and harassment and abuse, making sure that educational institutions also have counselors who are well informed and who are supportive of diverse sexualities and genders. So I think that kind of help is really needed. I think after the COVID pandemic, a lot of mental health issues have been worsened because the people have lost jobs, they've lost support systems and been forced to go back to their natal homes. We've heard of trans individuals who have had to go back to their parents, who have forced them to detransition, to stop taking hormones, etc., etc. So a lot of people have contacted helplines and so on, but we need a lot of ongoing support, even in the aftermath of the the lockdown and continuing into the future. And we can't separate mental health issues from other issues. So I think livelihood and income are also very important issues that can also interact with mental health issues. So we really need a very comprehensive response that looks at livelihood and economic security along with physical and mental health and support systems. So I think we need to continue to do work around preventing conversion therapy, because this is one area where doctors and the parents of LGBTIQ individuals work together to try and change their children. So we need a lot of education and awareness. And I think organizations like Anajari can do wonderful work in raising awareness because of your network and because of the approach of the members of your organization. I think you all are poised to do a lot of important work in your region and elsewhere, just simply by raising awareness.
Yes. Thank you, Ramuki. মই সুধিছিলোঁ যে কোনকেইটা দিশত এতিয়াও LGBTQ+ কমিউনিটি সমকামী সম্প্ৰদায়টোৱে স্বাস্থ্যৰ ক্ষেত্ৰত কোনটো দিশত এতিয়াও তেওঁলোকৰ দৰকাৰ আছে। আপুনি উত্তৰ দিছে যে মানসিক স্বাস্থ্যৰ যিটো যত্ন বা যিটো তেওঁলোকে সেৱা পাব লাগে সেইটো আটাইতকৈ গুৰুত্বপূৰ্ণ কাৰণ এনেই তেওঁলোকে LGBTQ+ কমিউনিটিটোৱে এনেই এটা সমস্যাৰ মাজত থাকে তেওঁলোকে মানসিক চাপৰ মাজত থাকে আৰু লকডাউনে সেইটো চাপ খুব বেছিয়ে বঢ়াই দিছে সেই ক্ষেত্ৰত অত্যন্ত কাম কৰাৰ দৰকাৰ আছে আৰু তেওঁলোকে সেইটো সেৱা পাব লাগে আৰু আপুনি ক'ব খুজিছে যিটো কনভাৰ্সন থেৰাপি যিটো এটা একেবাৰে অমানৱীয় কনভাৰ্সন থেৰাপি যিটোৰ দ্বাৰা মানুহৰ সেক্সুৱেল অৰিয়েণ্টেশ্যনটো যৌন অৰিয়েণ্টেশ্যনটো বদলাব খোজে সাইকেট্ৰি বা সাইকোলজিষ্ট বিলাকে সেইটো এটা বাধা দিয়াৰ কাৰণে সেইটো ক্ষেত্ৰত কাম কৰাটো বহুত দৰকাৰ আছে আৰু আপুনি আশা কৰে যে এনাজৰী যিটো অনুষ্ঠান এনাজৰীৰ মাধ্যমেৰে অসম বা নৰ্থ ইষ্টত এইটো দিশত কাম কৰাৰ এই দুটা দিশত কাম কৰাৰ খুব বাট আছে কাৰণ আপুনি যিখিনি মানুহৰ নেটৱৰ্ক পাইছে এনাজৰীত সেইখিনি মানুহৰ যিটো আপুনি যিটো তেওঁলোকৰ যিটো দেখিছে তেওঁলোকৰ পাৰদৰ্শিতাটো আপুনি আশাবাদী যে তেওঁলোকে এই দুটা দিশত যথেষ্ট কাম কৰাৰ বাট এটা আছে Thank you, Ramki. Our next question, next question to you is regarding Anazary's future. It's a formal organization, registered organization. My question is, how can we, convert Anazari, or how can we create Anazari a solid kind of social entrepreneurship that can boost or enhance mental health of especially of LGBTQ+ community?
Well, you are fortunate to have visionaries and activists like Milind Datta. I think it's definitely something that you can do. I think just the fact that you all have been organizing so many different forums, online forums, and possibly also offline forums in the non-COVID period to raise awareness is itself a very important thing. Maybe one way that Anajari could take this forward is to try to integrate maybe if there are existing LGBTIQ support groups in town, I don't know if there are, y'all could maybe collaborate with them, maybe share venue hosting with them, maybe provide a space for them to meet once a month or twice a month. Maybe y'all could invite mental health professionals to come and give a presentation and also be available for private consultation for community members who may need to speak one-on-one. These are things you could do. The other thing that I think y'all could really do in terms of your education mandate is actually reach out to educational institutions, whether it is colleges or schools from 9th grade onwards, where you can talk about issues like consent, you can talk about issues like gender and sexual diversity. One important factor when it comes to colleges is that in 2016, the University Grants Commission modified their anti-ragging regulations, where they explicitly named ragging based on gender, including transgender, and sexual orientation as factors that render people particularly vulnerable to ragging and bullying in colleges. And many colleges and universities are very aware of the anti-ragging policy, but they're not aware of this inclusion of sexual orientation and gender identity. So if there are, if you all have linkages through professional or individual contacts with academic institutions and with colleges and universities, you can make the university administration aware of this provision in the UGC anti-ragging policy and use this as an opportunity to do information sessions. Whenever we have done sessions for colleges, invariably there are some community members from the audience who reach us in private after the session. And then some of them have gone on to actually start support groups in their on their college campuses. So I think there's a lot that can be done, and I'd be delighted to interact with you all on this later. Some of our own work in Assam is concerned with maternal health in among tea garden workers. We're working mostly in Upper Assam, but we recently have awarded a Sati Fellowship to an LGBTIQ activist, Shivlal Gautam, who's based out of Guwahati. So I think there may be ways in which we can also collaborate further. Thank you.
Yes.
Milind has a question.
The question hour will follow after 5 minutes. Question, yeah. We'll take question after 5 minutes. Yes. Ramki, মই জানি ভাল পাইছো আপুনি কৈছে যে কেনেকে আমি মই সুধিছিলো কেনেকে এনাজৰিক এটা উদ্যমিতা কেন্দ্ৰলৈ আমি ৰূপান্তৰিত কৰিব পাৰো যাৰ মাধ্যমেৰে LGBTQ+ কমিউনিটিটো বা সমকামী ব্যক্তিসকলৰ কাৰণে তেওঁলোকৰ স্বাস্থ্য সেৱাৰ কাৰণে কেনেকে আমি কাম কৰিব পাৰো তাৰ উত্তৰত আপুনি কৈছে যে এনাজৰিত বিভিন্ন ধৰণৰ ৱেবিনাৰ বিলাকৰ মাজেৰে বিভিন্ন ধৰণৰ এৰিয়াবিলাকত আপোনালোকে সজাগতাৰ বাবে কাম কৰিছে আৰু আপুনি ভাবে যে বিভিন্ন সাইকিয়াট্ৰিষ্ট বিলাকৰ লগত আমি কোলাবৰেট কৰিব লাগে যাতে LGBTQ+ কমিউনিটিটোৰ মেণ্টেল হেলথৰ কামবিলাক কৰিব পাৰো আৰু বিভিন্ন ধৰণৰ আমাৰ গুৱাহাটীতেই হওক বা বিভিন্ন চিটিবিলাকত যদি LGBTQ+ কমিউনিটিৰ কিছুমান সংস্থা আছে তেওঁলোকৰ লগত কোলাবৰেট কৰি এৱাৰনেছৰ কাৰণে যথেষ্ট কাম কৰিবলগীয়া আছে আৰু আপুনি কৈছে যে 2016 চনত যেহেতু UGCয়ে স্পেচিয়েলি ৰেগিঙৰ এণ্টি ৰেগিং কেম্পেইনটোত যেহেতু ট্ৰান্সজেণ্ডাৰ বা কোনো জেণ্ডাৰ এণ্ড ছেক্সুৱেলিটিৰ ওপৰত বেছ কৰি কোনো ধৰণৰ ৰেগিং হ'ব নোৱাৰিব বুলি স্পেচিফিকেলি উল্লেখ কৰিছে সেইখনৰ আওতালৈ আপোনালোকে আপুনি কৈছে যে 9-10ৰ পৰা স্কুলত আৰু কলেজ ইউনিভাৰ্চিটিবিলাকত এৱাৰনেছ কেম্পেইনৰ কাৰণে কাম কৰিব লাগে সজাগতাৰ কাৰণে কাম কৰিব লাগে 2016ৰ UGCৰ গাইডলাইনছ মতে এণ্টি ৰেগিং গাইডলাইনছ মতে যেটো আপোনালোকে নিজেও সাথীৰ দ্বাৰা ব্যৱহাৰ কৰি গৈছে আৰু ইতিমধ্যে আপোনালোকে সাথীৰ যেটো এটা পুৰস্কাৰ আমাৰ গুৱাহাটী শিৱলাল গৌতম নামৰ সমন্বয় নামৰ যেটো অৰ্গানাইজেশ্যন LGBTQ+ কমিউনিটিৰ বাবে কাম কৰি আছে তেওঁলোকে আগবঢ়াইছে LGBTQ+ কমিউনিটিৰ কামৰ বাবে এইখিনিকে জানি খুব ভাল লাগিছে Yes, Ramki, we are towards the end of the session, but I have one special question to you, last question. Regarding the education of mental health and gender and sexuality, do you think if this education, that particular education that includes mental health, gender and sexuality education, compulsorily given from the school onward, if that is implemented in India, do you think that healthcare enhancement will be there for the LGBTQ+ community? Automatically, they will be enhanced in terms of their health.
Yes, absolutely. And I think that it would benefit everybody because it's not that only LGBTIQ communities are ignorant of issues. A lot of people are ignorant of basic sexuality and gender issues. So we need comprehensive sexuality education for everyone. And we would also like to have, mental health being a key component of education, at least in terms of service provision to students recognizing and taking mental health seriously, making sure that there are resources available, and not dismissing certain communities and identities as mentally disordered because they have a different sexuality or gender identity. We need all of this, but as you said, comprehensive sexuality education is really vital, as well as taking mental health seriously.
Yes. মই সুধিছিলো যে মানসিক স্বাস্থ্যৰ লগতে লিংগ আৰু যৌনতা যদি শিক্ষাটো স্কুলৰ পৰা দিয়া হয় আপুনি ভাবেনে যে স্বাস্থ্য সেৱাৰ ক্ষেত্ৰত এটা ডাঙৰ সকাহ হ'ব আৰু LGBTQ+ কমিউনিটি সমকামী কমিউনিটিটোৰ কাৰণে সম্প্ৰদায়টোৰ কাৰণে স্বাস্থ্যৰ কাৰণে তেওঁলোকৰ স্বাস্থ্য উন্নতিৰ কাৰণে কামত দিব আপুনি কৈছে হয় এইটো দিবই লাগে কাৰণ এইটো আমাৰ অকল LGBTQ+ কমিউনিটিয়ে নহয় আমাৰ ভাৰতীয় মানুহে ভালকে নাজানেই যে জেন্ডাৰ সেক্সুৱেলিটি কি বস্তু মেণ্টেল হেলথ আসলতে কি বস্তু আৰু এইখিনি জনাব লাগিলে আসলতে তেওঁলোকক স্কুলৰ মাধ্যমেৰেই নিব লাগিব আৰু সমস্যাবিলাক আসলতে এড্ৰেছ কৰিব লাগিলে আমাৰ ভাৰতৰ দৰে এখন দেশত স্কুলৰ মাধ্যমেৰে গভৰ্ণমেণ্টে এই এডুকেশ্যনটো দিব লাগিব জেন্ডাৰ এণ্ড সেক্সুৱেলিটি লিংগ আৰু যৌনতা তাৰ লগত মানসিক স্বাস্থ্য ধন্যবাদ ৰামকি So, Dr. Ramki is open for questions and comments from any participants. Milind Doctor, if you are present among the participants, you can raise a question or your comments.
Ramki, it's really great to see you after many years. You were one of the first person I contacted in 2014 when I had come back to India after 377 reinstated. And you are one of the reason or person who had encouraged to organize the first gay pride in Northeast. So anyway, my question is that the situation or the situation in Guwahati about trans women, um, I don't see much has been done to empower Hijra community. You know, so what is the scenario in your state? Are the Hijra community empowered? Have they got skilled to take other what do you call it? Other profession, or what is the scenario there?
Yeah, so the Hijra community here in Tamil Nadu is referred to as the Tirunangai community. And for easily 20, 25 years, the members of the community have been visible. And one way they got this early visibility was some people in the community were actually writers, and they joined a district level progressive writers associations, which are left-oriented associations, which encourage independent thought. So a lot of these trans women actually came out in the context of these writers associations or literary associations, and were able to convey the struggles they went through their literature. So some very fine literature has been produced in Tamil by trans community members. And very early on, I think in the mid 2000s, they also got the ear of some political figures like the then Chief Minister Karunanidhi, who was instrumental in establishing the first Transgender Welfare Board in 2008. Of course, that board was specifically for the Tirunangai community. They did not have an idea of trans masculine people at that time. But a lot of organizations have been working for the welfare of the Tirunangai community. There are many LGBT organizations or LGBTIQ organizations that also have trans feminine members. So we have mixed groups. And there are definitely a lot of people, for historical reasons, are practicing the traditional occupations of begging and sex work. And I think that really, as long as nobody is forced into something, people have the right to their occupation. But for individuals who want to leave and engage in a different profession, there have been some options, but historically, because of the limited access to education, a lot of trans people and gender non-conforming people being forced to leave home at a very young age and not having had the benefit of an education or facing violence and bullying in schools, that opportunity in terms of education has been denied. But we do have people like we have Satyashri Sharmila, who's a lawyer, who's from the trans community. In the neighboring state of Pondicherry, we had Dr. Samira, who's a medical doctor, who's from the trans community. So there have been quite a few people in other fields who have been working. So there's some visibility, news anchors, physiotherapists, nurses, etc. But in terms of numbers, there are very few. But they are there and they are visible.
Yes.
Okay, so I have another question: is that how I don't know how to put it. How is the state transport? Are they who are in the part? Are they very what do you call transparent? Are they do the community knows when they are meeting, what is happening, what money is coming? Are they transparent? And that is one question. And second, some people feel that only trans people should fight for trans rights, which I don't agree with. I feel that everybody can fight for trans right. I feel that everybody can fight for LGBT right. I feel everybody can fight for women's rights. Women do not have to fight for only women. LGBT do not have to only fight for LGBT, or trans do not have to fight for trans. So what is your opinion about that? And also, and how is your state trans council?
Yeah. So we have had the State Trans Welfare Board since 2008. It was originally called the Arvani Welfare Board. Arvani is now an old term for trans feminine people. After the Nalsa judgment, the government changed it to Third Gender Welfare Board, which is unfortunate in my opinion, because not all transgender persons identify as the third gender welfare, identify as third gender. And it's proven really difficult to include trans masculine people. In fact, only this year we've had a few trans men be able to get their identity card changed through the board, but the card is third gender. And when they want to change it in the Gazette as male, they face challenges. But historically, I mean, Tamil Nadu has had a strong press. The government has made public all the money going towards different activities, including transgender welfare activities. And these are in the budget and these are on the websites of the different government departments. So it is open and transparent to everybody. And some of the members of the trans board are quite accessible. If community members have problems, they can go and speak with them and they can get support. So that's definitely a plus point. Regarding your issue of who can fight for what, for rights of which group, I completely agree with you that every group needs to be in solidarity with each other and support all causes of social justice, whether it is trans or cis women or women in general or gay, lesbian and transgender people, gay, lesbian and bisexual people. I definitely agree with you. The one point that I would probably like to add is that if a particular sub-community wants to articulate their issues in their own voice, people who are allies of that community have to make sure that they stand back and ensure that the community voices are heard directly, from the individuals. So this has been something that I've been thinking about. Historically, what has happened is in many states, trans men have not been that visible compared to, let's say, trans women. So there have been communities other than trans men who have spoken up on issues of trans men, and I have done so too. But I think that there's a point where one has to focus on ensuring that the trans men communities are in a position where they can articulate their own rights before the government officials and so on. And one has to set the stage for that. It doesn't happen overnight. So I think, yes, overall allyship is needed, but we have to ensure that the voices of the marginalized communities are center stage and that others who are allies facilitate that.
And then last comment, it's not a question, is that I would happy to inform that we have been talking to various colleges, I think since 2018, many colleges in Guwahati and Jorhat and Dibrugarh and stuff like that about LGBT awareness and stuff. And we also had a LGBTQ support group. I think it was in 2019. And we are restarting. In fact, we are collaborating with a Somil is a mental health support, mental health provider or NGO that provides mental health. We have been working with them and we are planning to restart the support group. Maybe in fact this week or next week, we haven't confirmed, but that will be again support for LGBTQ. And hopefully we will start also for parents of LGBTQ too. And then eventually a trans group. That is our goal. So we'll be reaching out to you, and good to hear that you have already had given scholarship to several, and hope that we can continue working, work with Sati.
Thank you. Thank you very much. It's a pleasure and honor to be here. Thank you, Dr. Mukul. Thank you, Milind. Thank you, Kashmira, everyone. Bye.
Yes. Thank you, Ramki. Thank you for joining us and giving us a lot of inputs from your part. Thank you, all the participants joining us. And thank you, Kashmira, for helping us technically. Thank you all.